A lot of your public health problems are in your more rural areas where they really ought to have more resources and they get less resources, where the doctor may come once a week, at a certain time, and he's in his, it's a line running out the door of people lining up, where pharmacy would be the place that ought to happen. Yeah, healthy children are healthy adults.
Yeah, the engine is built. I mean, the experience is there. We've proven that we can do that. So to me, it's very, very logical that just continues to expand. And maybe VFC, Vaccine for Children's, wouldn't be for all pharmacies, but I think pharmacies deserve the opportunity to play a role if they would like to. But the pushback, we receive isn't necessarily, very pharmacist friendly. And I understand there, scope creep,
right,
et cetera, but is there not enough work to go around? Are we really satisfied with what vaccination rates are? And VFC is a very successful program, thousands of VFC providers, but there's only 300 or less that happen to be community pharmacy. And there's a reasons for that, the way the system is currently constructed.
And really your analysis shouldn't be in your scope creep. Your analysis shouldn't be, taking money away from, they're taking money away from the pediatricians. Well, no, you're trying to expand care.
You are. And pharmacy interoperability is another topic we discussed. And, maybe that solves some of the ills related to, well, if this child happens to get a vaccine at a pharmacy, then we might miss out on opportunity on a well child visit is the classic example. But could we not spin that in a way that, no, we are an outlet for you to ensure that somebody is getting vaccinated here? Why is it that they're uninsured? Should people in our country be uninsured? Is there a path we can help them get to the right resource to potentially get coverage? And oh, by the way, I noticed that you're coming here and we're thankful for that, and we'll take care of you. But when's the last time you had a pediatrician visit or a primary care visit? And I know that has been loosely discussed, and we need to kind of further define
in a public health. As the pharmacy, you ought to get paid for that vaccination, and you ought to get some kind of success payment if you can get that child to see a pediatrician.
No doubt.
Right? About helping them get there. That's what a lot of public health is people getting paid, social workers or people trying to get people to get the care they need so that things don't get expensive.
Right.
Yeah.
And you guys know it. I mean, what a logical place to be a quarterback on behalf of patients. I mean, if it's you don't know when the moon and stars are going to align and they're like, today's the day I want to get my flu shot. Well, it's pretty cool that they can go to your place at Tuesday at 8 p.m. or Sunday at 1. That accessibility, the flexibility, the scalability of pharmacy is just so logical to me that if we want to see, vaccination rates improve, that's the place to go. But let's not stop there. What other problems do you have, public health? Like what else are we trying to solve for?
Well, that's the biggest thing is doctor offices are only open Monday to Friday, 9 to, and it's like sometimes Tuesdays, that's the day they're closed. And as a mom who's running between soccer schedules and that, the flexibility of Saturday, a game is finished, texting the pharmacy and just going, hey, did you get flu shot? And yep, cool, we'll be there. I need 3 shots. And then I walk in the door and it's ready.
But that schedule you talked about, as you move to more rural areas, and then I say rural, maybe, 10,000 something, you end up in worlds where that doctor may work 4 days a week in 3 towns.
Yes.
Right?
Yes.
And so he's into this town on a single day.
Right.
And when he's happening there, it's big.
Mm-hmm.
Why in the world are we doing vaccinations in an environment like that?
Yeah. We were approached at Drug Mart, based on the relationships we created with public health along the way to be an extension for STI clinics that in a rural county, but they only had 2 clinic days, like a week or a month or something, where they just said, hey, could you be an extension of our process? And
because you're open.
Yes, we can. Yeah. And here's the protocol, and this is what we need you to do. And